record. You guys want me to go first for what I found?
Yes.
Yes, please.
Okay.
We should review our case study.
Oh yeah. Britt, do you want to review our case study?
Oh, yeah. Then I have to find it. One moment. Laura, you jij hebt het beter gemaakt, toch?
Nee. Jawel, maar op mijn oude laptop voordat ik de hele schijf heb gewist. Dus ik heb hem nu niet.
Oké.
Maar het was prima. Het zag er mooi. Ik heb echt vet weinig veranderd.
Okay, so should I read my case?
Yeah.
Okay. So in 2013, my father went to the doctor with a weird birthmark. It had a crazy color and he often bleeds. The doctor did not trust it and sent him to the hospital to a dermatologist. Oh jeetje.
Dermatology?
Yeah, thank you.
Yep.
There the birthmark was removed and sent to a laboratory for research. It seems to be melanoma, and a second opinion was necessary to remove all the cancer. The melanoma was above his nipple, so they have to remove his nipple too, because it is necessary to remove 2.5 centimeters around the birthmark, because they may also be metastasis. Stasis. I don't know. Okay. So right now he has only one nipple. He could have the nipple tattooed, but he didn't want that in the end. He thought it was okay to have one nipple. There fortunately was nothing in his limbs. That means he was clean after his second operation. He did not need any future treatment like chemo or radiation. It was a hard time for us as family because we did not know which way it would go, or of course you don't have any control of the situation. My father still goes to it. Oh, the difficult word. Dermatologist. Yes.
Yep.
For checkups. First, it was every 3 months. After 2 years, every 6 months, and now he had to go back once a year. Sometimes a few birthmarks are removed for certainty during these checkups. And now it's 5 years ago, so he's cancer-free.
Okay, so for my article, I found one on melanoma, which is skin cancer. And it was just like a short article, but it talked about like how much it costs here in the United States. So it said it was $1,241 per person per year for the treatment of melanoma, and then it kind of talked about how how your dad had to follow up so many times at the doctor, how that can cost a lot of money. So they kind of talked in the article about how they can help reduce that cost by doing like at-home clinics, or instead of like going to a dermatology, just going to like a regular doctor, stuff like that to help reduce costs. And then it said it was $2.2 billion per year of professional fees for skin cancer related diagnosis in medical patients. So I thought that was a lot of money. So that's what all that article kind of talked about. But I found another article that kind of talked more in depth here about just cancer and in general instead of just skin cancer. I kind of talked about like the cost of drugs here in America as kind of like the cost of medications that are needed. So 374 billion on prescription drugs, and then let's see, it was 32.6 billion for oncology drugs, which is 9% of the overall drug cost in America. Sorry, let me see what other points I got here. And then like for supportive care treatments such as like radiation or stuff like that, or like follow-up treatments, it costs $11.1 billion a year for that. And we talked about like per month, like out-of-pocket cost. Like without health insurance, it was $24,000 a year for families to $36,000 just for the drugs for cancer. So I thought that was a lot of money to pay outside of insurance. And they talked about one drug that it's called, I don't know how to say it, Gleevec. It was a leukemia drug, and talked about how it increased in 2001 it was $24,000, and now today it's $90,000. So just kind of talk about how much drugs are increasing even though you need them.
Mm-hmm.
So that was my articles.
Okay. And did it, because you talked about insurance?
Yep.
When you have insurance, does that take some of the cost away, or how is that?
Yeah, they talked about, let me see. They said that in this article that people usually pay 20 to 30% out of pocket, and insurance will cover the rest.
Okay.
That was like $24,000 per year out of pocket. So, but otherwise, insurance covers the rest. But it's clearly not enough. So.
No.
Mine kind of talks a little bit about it. If I want to jump in there, I guess a little bit following that.
Please.
Okay. So mine was like, I didn't do it like directly on like cancer. I just did like medical issues, and I was trying to find more so like time off and like what we're allowed. But I couldn't really find a nice peer-reviewed journal article on time off, because every job here is going to be different, you know, whether it's you work at Walmart as a cashier, your time off is going to be different from accountant at a bank, you know.
Mm-hmm.
So I couldn't really find like a general thing for that. So this one was just, it talked about like bankruptcy from medical issues. So in this study that they looked at, it was like 46.2% of bankruptcies in America were from medical issues. And then the people were like middle-aged and middle class people. And when it compared it to like other people, other bankruptcy people, or other people who have bankruptcy, not medical related, it was like some of the medical bankruptcy people had like slightly lower incomes and like education. So it's like you kind of wonder if that also, you know, plays a role into their medical problems. But so it talked about like their out-of-pocket average cost for these medical issues. It wasn't, because it wasn't just cancer, it's like the medical issues was $17,943. For the uninsured, it was like $26,971. We have a Medicaid insurance. It was $14,633. Or a Medicare insurance was $12,021. There's a part on veterans. Their average cost was $6,545. And the average for people who had insurance but lost it throughout their time was $22,568 out of pocket. So yeah, like it talks about, you know, these different types of insurances, and so mine was like less than Mary's, because Mary's was more directly to the melanoma, but just like these other medical issues. So you can kind of see that, I don't know, like our healthcare system, I wouldn't say is, you know, the best with that, because that's a ton of money out of pocket that people are expected to pay, and
yeah,
a lot of people don't have that.
Is health insurance, is that required for you? I mean, is it? I don't know even this word. Is it like? Is it required that you have health insurance?
Well, when we had President Barack Obama, he made it required, I guess. But like if you didn't have it, like you could either have this affordable health care or whatever, or you could like pay more to like not have it.
Okay.
Or something like that. So I mean, there are still definitely people who don't have it and they still can't afford it. So yeah, they're supposed to.
Everyone has to have some kind of insurance, so it's like even my sister who didn't have a job for a while, she had to pay I think it was like $20 a month or something for a cheap insurance that doesn't really cover a lot, but everyone needs health insurance in America.
Yeah, okay.
Yeah.
Yeah, found the word. It's obligated. There we go.
Yes.
Yeah, it's okay. Because I could jump in there because I looked up, something about Dutch insurances. Because it's also obligated in the Netherlands to have insurance for your health. And it's called, wait a minute, where's my document? There we go. It's called a basis health insurance. That's what you need to have. And yes, here it is. Good. This insurance, all of our insurances have something called own risk. And this is that you, it's an amount of money that you have to pay before the insurance takes over. I believe that in the Netherlands at the moment it is €385. But once that is, once you've paid that for your own health costs, the insurance takes over as long as it's in the package that you're paying for. So that means that from then on the insurance pays, but every year you have to pay that €385 if you get ill or something. But that the government did that because otherwise people went to the doctor for every little thing and they wanted to put that back a little bit. So now you have to pay the first bit on your own and then it is taken over by the insurances. And also I looked up what the cancer treatment would be, what that would cost. I only looked up like the first consultation for the dermatologist, and then the investigation that they do for if you have it, and then the operation, and that would be about €1,105. But that's without the follow-ups and without actually going to the first doctor you go to, without those kind of things. So that's already a lot of money, and that's not even with all the checkups you have to do after that.
Mm-hmm.
But I believe
that was money you're paying out of pocket, you're talking?
No, that's the money that it would kind of cost for everything to happen, but that would mean that in the Netherlands you would pay €385 yourself, and after that the insurance takes over.
Okay. We have that, we call it like a deductible that we have to reach. We have it for like the year too, and then, but everybody's is different, or
Mm-hmm.
I feel like most people's are different.
Yeah.
So like I was just on my mom's, health insurance, and her deductible was, I'm not sure, I don't remember exactly what it was. And now my mom just retired, so now we switched over to my dad's insurance, and his deductible is like it's like, tripled what my mom's was.
Oh.
So it's okay because, we're all, fairly healthy, and it'll cover like if we have, a big issue, it'll be okay.
Mm-hmm.
But so like right now it's like none of us want to go to the doctor because we know we have to pay for each thing.
Yeah.
Because to meet the deductible or your 300 and some,
Yeah, it can be different in the Netherlands. But then like if you pick a very cheap insurance, then you'll probably have a little bit more of the deductible. But if you have like a more expensive one, insurance, then it could be that your own risk is cheaper.
Right.
Well, but that was kind of what I looked up. So.
All right, Brett.
I looked up about how long you can stay away from work if you're sick, and about the money. So we split up. Laura did the medical thing, and I did the money thing if you stay away from work. And when you're sick, you have to report that to the condition service or the company doctor. Then between the 2nd week and the 8th week, they will make a plan for your illness, and then they describe what's going on and how they want to get the employee back to work, and it's kind of difficult. And they can describe what they're going to do to get the employee back to work. Hereafter, the employer must keep a file with the cause of the illness and the activities that take place. Every 6 weeks, there must be a conversation with the progress, and in the 42nd week, the employer must report the employee ill at the we call it the UWV. This is an insurance institution, and and after 2 years, they will evaluate, and discuss. Thank you. And discuss the treatment plan for the 2nd year. So what they're going to do, and how they will do it, and what you can do besides work to go back to work. And if you are not going back in 2 years, you often considered that's a difficult word.
Wil je het in het Nederlands zeggen?
Ja, dat je arbeidsongeschikt, dat je daar...
that you're incapable to work anymore. Then you're considered like it's not going to be possible for you to work again, even with a longer waiting time.
Yeah, thank you. That's about what they're going to do in 2 years. And the first 2 years of your illness, your employer has to continue the paying. And in totally, you can get 170%. Dat hetzelfde in Engels? Is procent hetzelfde in Engels?
Percent, yeah.
Okay.
Right? I believe so.
You can get 170% of your money, so you can split up if you want. For the first 1 year, 100% of your money you can choose, and the second year you can get 70%, or you can choose 1 year you get 70% of your money, and the second year 100%. So that, you can choose between that, and that's what I look up in an article. I don't know if you get anything of it.
No, so that 170 or 17%, that's after 2 years, you said?
No, within 2 years.
Okay.
So you can stay home for 2 years if you're ill, and after 2 years, you are incapacitated. Laura?
That's the thing. Incapacitated, is that it? Incapacitated, there you go.
For work, but in the 2 years you're ill, you can get 100% of your money.
Okay. Do you know how it works for us, Mariel? I think we all get so much time off and then we don't get paid anything, do we? except for like unemployment?
Yeah. So okay, my dad just got is on that now actually, because so he has it's like peripheral neuropathy like in his feet, like it hurts like way too much for him to like walk, and so he had to go to the doctor, and they got like notes or whatever, and then he had to be like checked out by another doctor of like the company's doctor, and all this stuff. And so he was out of work for probably, I don't know, 7 months. And so he used up like all his sick time and his like paid vacation, and then we just weren't really getting anything from it then, I don't think, because that's how his work works, I guess. But then once he got like checked out and cleared by the company's doctor, then they were able to go back in and like back time his pay. So then he got like paid for this time, but then now he's on like Social Security disability. So
That's through the government, right?
yeah,
Okay. They just settle him at like off of his paycheck, or you don't know?
he's not making what he would on his paycheck. He's making a portion, like 70%,
Okay.
I believe.
Because my mom doesn't work during the summer and she gets unemployment. And it's not disability, it's different than disability, but she gets like a portion of her paycheck, but not the full paycheck. For those she doesn't work. So
No, okay. Yeah, well, I didn't know that, but with her, I thought she got a percentage also, but apparently you can choose if you want the 70% the first year or the 100%. So we can apparently get everything.
Yeah, my father told me the first it was you get 100% of your money for the first and second year, but now they changed and it's like 170 instead 200%. For the last years they changed it.
Okay.
So if you get better, this might be a dumb question, but if you get better in 2 years, can you go back to work then? The same.
Yeah.
Okay.
Yeah.
So
Yeah,
they kind of save your position for 2 years.
Yeah, it's more like will you get better or don't you? So if you don't, yeah, then you are incapacitated.
Incapacitated, yeah.
Yeah, thank you for work. But if you can get better, you can go back to work, but it will be yeah, you have to take it easy, like 1 day work, or you work at home or something.
Okay.
Yeah, but that, if your employer knows that you'll be ill for a longer period of time, then they'll probably look for somebody else who will do it for that period or for a period in that period.
Mm-hmm.
So it's not like the job isn't done, but you will be able to officially you should be able to return once you get better.
Okay.
Okay.
Well, I feel like I learned a lot.
Same.
Hopefully you guys learned a lot about our country.
Yeah, it's
I was not, but just kidding.
very interesting. But I'm having a bit of difficulty with seeing what we will be able to, because tomorrow we have to record a presentation of our conclusion. At the moment, I'm not seeing what we should tell them. So
let me just pull up the rubric for that one.
I think it only has to be like 10 minutes too.
Yeah, it doesn't have to be long, but
Yeah.
I believe it was about what our conclusion was about. Well, the differences or the similarities, or at least about what you've learned from the other one's article and what your conclusion would be in this situation.
Right.
Something like that. But
Yeah.
I think that's difficult with our theme.
Yeah. So, okay, like introduction of us, and then Britt can present a brief presentation of the case study if she, wants to do that thing again. And then, okay, discuss the main points that we did in part 5. So today's, so I think we did the 2 time off and like cost, but I do agree because I feel like it's different for every single job. Like there's not like a standard.
Yeah. In Holland there kind of is, I believe, because your employer, and I mean, like if you have contracts here that you work 0 hours in a month, but then you can get paid for the last month the hours that you worked. So then you wouldn't get anything because on your contract there's that you work 0 hours. But like if you do have a normal contract with hours on it, then you should get the money that you normally get even if you don't do the work. I believe
Okay.
it doesn't matter which job you're working.
Well, how about, okay, so then you guys kind of discuss like the standard way, I guess, of your time off or how your insurance, pitches in.
Mm-hmm.
And then we can kind of talk about how there isn't really a standard and different examples of what they do, I guess.
Yeah. And because I think in the end we kind of have to have a conclusion of what we've learned from this research.
I can maybe say like the 2 years off and getting all that pay is a lot more like, okay, here, if you get a big illness, it could definitely cause you to go into like huge amounts of debt, where with you guys it's less likely to happen maybe.
Yeah, I do think that's really one of the bigger differences.
So maybe that we could have that be kind of our main conclusion.
Yep. Sounds good to me. What about you?
Yeah, I think that's good. And then like you talked about your deductible thing too, the 385 euros. I think you can bring that up because that's like out of pocket costs, and ours is like way more than yours.
Yeah.
So we can mention that. That's a big difference. Otherwise, yeah, I think the conclusion was good.
Yeah. Okay.
And we don't have to make like a PowerPoint or anything, right? We just talk.
No, we do.
We do have to.
I think so. In our rubric, we did.
Oh.
I don't think, is that possible over Zoom? I think we just have to show this video in class, right? But
Yeah.
Oh, okay, I guess so. I know other kids in our class were making PowerPoints, so.
yeah, but maybe with the video, or just like with the video in it, did they make the PowerPoint themselves and just put the video in it there, or did they really make a PowerPoint in the video?
No, not in the video. They had like a PowerPoint, and then we just kind of had like our words to go along with it. Yes.
Okay, but we don't need one, so we're good, right?
I guess.
And who will tomorrow? Who will tell our conclusion?
Oh wait, no. Okay, this one says the presentation must be recorded and include both visual and audio.
Yeah.
So we need to have. Oh, does that mean like us visually?
Yeah. You have to see us and you have to hear us talk. I believe that's it.
Okay. I pretend I didn't say this.
No, it's fine. It's on video, but further than that, we'll pretend.
Okay. Marielle, would you like to do our conclusion since you did it so beautifully today?
Yeah, I can do the conclusion.
Okay.
Perfect.
So then we'll all introduce ourselves real short. Then Britt will present the case. And shall we do the same order that we did today with the art?
Healthcare first versus yours.
Yeah.
Second. Yep.
That works for me.
Yeah. Okay.
All right.
Well-
if you have any questions, we'll just like maybe message in the
Yep.
thing.
And what time tomorrow?
You have class tomorrow, don't you, Marielle?
What day's today?
Today's Tuesday. Tomorrow's Wednesday. I think you have sim.
I'm gonna look for my phone real quick.
I do have sim.
Is it afternoon or morning?
Afternoon,
There.
I think. I think.
Okay, we'll maybe get back to you with the time.
Okay, that's good because we have class tomorrow too, as well. I just don't know until what time, and right now I'm having a blank screen, so that's awesome.
Okay. Yeah, just we'll message you as soon as we check our schedules here.
Yes. Okay. Well
You
then.
do the same for us, okay?
Yep.
Okay,
Well then.
perfect.
See you
All right.
tomorrow with a great presentation.
Yes, it'll be
Here's
good. All right, thanks, guys.
Okay. Bye.
Bye.